everyone, welcome to another episode of Letstalkfurreal. I'm Mary and I have with me Dylan. And today we have Dr. Moses, veterinary surgeon at Evervet Veterinary Clinic and adjunct lecturer at Ngee Ann Polytechnic. Hi Dr. Moses, thank you for being here today. Please tell us a little bit more about yourself.
Thanks for having me, Mary. Well, there's not much to say. I think you've said quite a lot already. So I'm a vet at Evervet Eunos, or rather primarily at the Eunos branch. We have two branches, one at Bedok, one at Eunos. I am also an adjunct lecturer at Ngee Ann Polytechnic. I recently did the pain management and anesthesia course, as well as the emergency and critical care course for the specialist diploma students. If anyone is keen, they can always write in. Not to me, but to the school. So a bit about myself. Where do I begin? Maybe from the start, I suppose, right? So what sparked, or what was the drive? I think very cliche, but very true answer for me. It's a kind of a childhood dream kind of thing. I was young, I was like, oh, I like animals. Then I kind of tried to figure out what sort of, roles we had. So, zookeepers, veterinary technicians, lab techs, all that sort of thing, but also the vets. And I think, deep down inside, there was something that just a part of me that wanted to be a vet. I think through the different experiences I've had, I was also trained as a vet nurse/technician at Ngee Ann Poly many years ago. I won't reveal my age, but also some time spent with the zoo as well, just to get to know what they do. And through it all, I think deep down inside, still there's something inside that wanted to continue to do a bit more, So I decided to apply for the vet course. Then I got accepted by the University of Glasgow. So that's where I studied. I think some of your previous guests are my seniors as well. So wonderful school, a lot of fun, wonderful scenery, a lot of travel as well. And then, school was the fun part, and then working, right? Working is the more fun part, actually. No more exams, but I think some would argue every consultation is like an exam. You need to know the answer more than I think you need to know the answer for school. So a bit about my work experience. I started off working in the UK. I was actually employed by a chain practice called Vets for Pets. I was based in this part of England called Lytham, St. Anne's, and also Blackpool. So it's kind of very used to shuttling between two different practices. This one, my bosses own 5, so I kind of shuttled a bit more, but usually between 2. After that, an opportunity came up to work with wildlife in Singapore with MParks. So that's where I decided, okay, I'll come back home and let's see where this takes us. So he offered me the job. I accepted it, and I think for the last 2 years, I have been very privileged to be able to work with a very fantastic team in the wildlife department. Big shout out to them, and also for everyone else who has helped support me through that journey as well. The immediate team, as well as all the friends and colleagues that have helped along the way. So it's been very exciting, and then part of me decided, okay, now that I've had a bit of fun, maybe I need to do a bit of work and help more patients, because wildlife work is wildlife work. I think clinic work is a slightly different thing as well. And it also stemmed from a place where I wanted to learn a bit more and improve a lot of the skills that I felt I was lacking in. So I decided to come back to clinical practice, and I decided to stay. Evervet offered me quite a good deal, I suppose, and then I said yes. Yeah. So not a proposal story per se, but that's where I am, that's how I got to where I am. Yeah.
Right. So is there any difference practicing in the UK and Singapore?
Oh, for sure. Well, I think language is one thing that is quite different. In the UK, I think primarily everyone speaks English. Everyone understands things a little bit different as well. So certain topics like, I think, end of life, euthanasia, the conversations I've had with clients there and here are very different. We tend to, I suppose, in the UK, they are a bit more, I say open, but they're more willing to talk about these things, and they do consider it. A lot of them are at a point where they're like, okay, it looks like nothing else we can do, maybe this is the kindest thing we can do. Whereas in Singapore, I think maybe it's a Asian mentality. It's like we must try our best. And I think not to say the owners in the UK don't, but I think they see it from a different perspective. I think in Singapore, a lot of the owners feel, or they treat every pet as a member of their own family. So we will keep going until the pet can't keep going anymore. I think it's the general sentiment. We definitely do get clients or pet owners who also can recognize that, we've really done what we can. We can't do anything better for, our I want to say fur baby, but not everyone has a fur baby, right? So this member of the family, and we have, I suppose, this option to end that sooner rather than to stretch it out, lah. And some of them do make that difficult decision, but I suppose a difficult but kind decision to say, goodbye. I think but then there are a lot of similarities as well. Sorry for the slightly more serious conversation. End of life is part of what we do. But also, I suppose the funny or the interesting part is, I think there's a lot of similarities with pet owners everywhere. Like I mentioned before, they are a part of the family, so you also feed them as if they were a part of the family, which also means you feed them whatever you're eating also. Like I don't think that has changed, be it in the UK, US, Singapore. You get all sorts. Everyone is asking, we get asked questions all the time. Oh, can I feed him a bit of, chocolate biscuit, ice cream, the bit of steak they had, and you're like, okay, this is constant, I suppose, quite comforting. It doesn't really change, and so it's also, my advice also doesn't really change, stick to food that we know has been made to be good for them. Don't go off script too much. In that sense, we do tend to see a lot of things like pancreatitis or even toxicities, when we feed inappropriate diets, or nutritional imbalances, lah. I think if we talk about the exotic species, we see that even more, because people think, oh yeah, in the UK we get people who keep all sorts of like reptiles and stuff, so they're like, oh yeah, he just needs to eat meat, and then after a while you tell them, no, look, your snake is a carnivore, but in the wild he doesn't just eat steak, he eats whole prey. There's a lot more to it. You get your fiber, you get your bones, you get your organs. It's not just chicken fillet, beef steak every day, right? So there's a lot that I think, but you also get those people that really know what they're doing, and sometimes I defer to them also. We have, I suppose that's the other thing in Singapore, and perhaps I see a bit more in Singapore, that the clients do really, more clients in Singapore tend to know their pet a bit better. In the UK, sometimes it's I've just got this dog because, my friend gave it to me because he's left the country and now he's just sitting in my house. I just keep him alive, okay. But I think in Singapore, most of the time, it's a bit more of an intentional decision. Definitely not. I'm under no illusion that people do get pets from their friends, that, oh, my friend has left the country, or my friend can't care for this anymore, so okay I go and help. I pick up this stray. And I suppose on that topic as well, I think in Singapore we see a lot more people adopting strays. I suppose UK we don't see that many. People do adopt, but it's usually through animal charities, so like places like SPCA, PDSA, and then a whole lot that they have Dogs Trust and everything in between, lah. Singapore, we also have so many welfare groups out there, right? So we have we also have SPCA, AVS also has a fostering program, and I think a lot of our different animal welfare groups as well out there. Too many to name. Then if I name some, then later they scold me. So I don't want to name. Okay, but SPCA and AVS, everybody knows, lah. Huh? Yeah, so we have everyone else in between, everyone trying to do their best. And I think we see a lot of such animal welfare groups as well in Singapore, and a lot of people who are very open-hearted, very big-hearted. They take in, I've been feeding this stray for months, and he's following me home now. And okay, I'll give him a home to stay. Which is very heartwarming, lah. I suppose in the UK we don't see that many strays in that sense, because maybe the weather also doesn't facilitate that, lah. They don't tend to survive winter very well, so maybe that's the big difference. Yeah.
So I believe that you probably see a lot more species in the UK as compared to Singapore as well, right? Like different types of pets, like snakes, like you mentioned.
Yeah.
By right, you shouldn't be seeing snakes in a vet clinic, lah, right?
Well, I haven't, so I hope not. I think based on my particular experience, I have seen snakes, but not in a clinic context, lah. So when I was dealing with wildlife, definitely, I think I was a lot more familiar with snakes and birds and everything else but dogs and cats when I was with parks, lah. And that was the nature of the work. But I think in the clinics in the UK, definitely we get, very common, like the UK, or rather globally, your common pet reptile species would be like your bearded dragons, your leopard geckos. We get the odd sulcata tortise, Herman's tortoise, that kind of thing. Red ear sliders, people still keep them. It's everywhere. Birds also. I think birds is one constant. Like everyone has birds, and usually some sort of parrot. But I think in Singapore, we do see a lot more songbird owners as well. Whereas in the UK, they tend to be more inclined to keeping either your hawks. People do. Well, there are a lot of people that keep hawks. There are a lot of falconers. But I think also equally large amount keep parrots. I think that's the common denominator are your parrots. But just different breeds. In terms of the very exotic stuff, you see snakes, you see bearded dragons, your ball pythons, iguanas as well. Yeah, we see a whole host of over in the UK. Singapore, they were quite. The scope is smaller, which sometimes a bit more of a relief for us also, because I just need to think about red ear slider, and Malayan box turtle, and that's all the reptiles I should be seeing, lah. Yeah.
So, Dr. Moses, just to check with you, are you afraid or scared, when you need to consult snake or those kind of very fierce animal? What if they bite you? You self-medicate, or you need to rush to see a doctor yourself?
This is a hard question to answer on air, Dylan. I will tell you the correct answer. I immediately seek medical advice, from professional medical doctors. Yes, I don't tend to self-medicate. No.
Okay.
I think I think most vets go into any consult with any animal with a certain prudent, healthy fear of getting bitten. If you're not afraid of getting bitten, that's not good either. I think we've seen those videos, right? The golden retriever bites off the owner's nose, that kind of thing, and they're the happiest dog in the world. I think every animal has the potential to bite you, scratch you, or hurt you in some way. Knowing the animal you're dealing with, knowing their behaviors, all these are very important. I think particularly with my time in parks, we also did some training for people who handled wildlife, and a lot of it was also educating them on what are the normal behaviors. How do you approach an animal safely? Even for us, we deal with snakes, we deal with things that are a lot more dangerous than their wildlife. So it's either fight or flight, right? So if they can't engage the flight response, then it's going to be the fight response. And how do you provide a place or an encounter for them they're safe for you and them at the same time. So I think the fear is always more of, am I going to give this animal a bad experience? If it bites me, okay, that's on me because I didn't know what I was doing. And depends on the severity. If it's a small scratch, you just wash your hands, disinfect, and carry on with life. If it's something a lot worse, then of course I'm not going to pretend I can reattach my thumb kind of thing, Yeah.
Because I know this groomer. I know a friend, a groomer. I think he was grooming this cat, and all of a sudden this cat just scratch her. So I think the wound, I will not say deep but it's kind of bleeding. So she tried to self-medicate first. Then after that, the next day it got swollen. Yeah. So he rushed to hospital, and I don't know, they just give him the checkup, everything. Yeah. So I believe nowadays there's a lot of groomers try to trim their pets' hair themselves. Maybe out of the sudden the cats or the dog might beat them. So the best advice is seek medical first.
Oh, definitely. I think as a rule of thumb, any sort of bite wounds definitely get that checked.
No self-medication.
Not a good idea.
So do you have any species that you favor particularly?
that's a bit, yes, everyone has a bias, I
Yes.
suppose. I personally like fish. I think that was possibly the first type of animal I kept as a pet. And I like the variety. They're very interesting in terms of me pursuing them as a, I suppose, am I going to be a fish specialist? Probably not anytime soon. I think it is very interesting. I do enjoy working with fish and the aquatic species as well. I have had to figure out how to medicate some as a result of my work with wildlife. I haven't had someone bring their goldfish into the clinic, but I think the advice what I always say when someone asks, do you see fish? Is I will do my best, but I'm not a specialist lah. But yeah, I do like fish. They're very interesting. I think you get so many varieties. They come in so many shapes and sizes. But it's not to say I don't care for the rest of the animals. I still like animals in general. Just fish have maybe a special place in my heart kind lah. Yeah.
Are you able to interact with fishes like how we interact with dogs and cats? Like, do they react to you and all that?
So I think it depends on the fish itself as well. So I mean, as with like even dogs and cats, right, different. But there's an individual component and there's a species component, the breed component as well. Some breeds are a bit more interactive, some breeds are not. So like some people that keep like cichlids like the Oscar or even your Lohan or your arowanas, you notice some of them are a bit more, they know you're coming, they know, okay, this is the person that feeds me, and then they follow your finger. Some of them are like, oh, you come home, and they go and swim closer to the edge of the glass, So you get that. Of course, sometimes it's like you keep smaller fish like guppies or like neon tetras, then they just mind their own business. They don't really care what you do lah. So it depends. But I have had fish that are a bit more interactive and some that just look at you and you look at them, then they're okay, fair enough, bye.
I used to have Rohan before, when there's a few years ago, there's a trend, everybody is trying to keep Rohan. Yeah, I agree with you, when you go home, you just try to knock on the tank and the fish will come to you.
Correct.
Yeah, but I'm quite curious. I always wanted to know something, how you treat how am I supposed to know when my pets, especially fish, is sick? I only know that, when they turn over, the stomach facing.
Is that too late?
Well, it depends. It depends on the cause.
That is where I know you start to, go slant a bit when he falls sick.
Yeah. So I think
I bring the whole fish to you or what if I want to consult.
Bring the fish with water lah. You bring the fish, I will help you wrap it lah. That's about it lah.
That one will be burying underneath the ground.
You want ashes or no ashes? Or grilled or steam? So I think in principle for any animal, knowing whether they're sick or not, also it requires a bit on honestly, we get a lot of information from the owners lah. If you were to come in and ask you what has changed, new food, new diets, new people, someone knocked the tank very hard, say for fish lah, do you notice any color changes? So as with any animal, any sudden behavior change is out of the norm. Something is very active, usually very happy to see you, suddenly it's just hiding in one corner. That's a bit off, not eating as much as it should. If it's the kind that you can see how much water they're drinking, not how much water, any very obvious physical changes, swollen face, swollen eyes, obvious wounds, bruises, even pee and poo as well. How much are they peeing? How much are they pooing? Normal? Is it diarrhea? Are they constipated? Is there blood in the pee? Are they unable to pee? Or do they struggle to pee? Are they peeing more than normal? Like there's so many questions that you need to ask. But I think these are all things that you would notice at home as well. I think getting to know your pet is probably one of the first and the most important and helpful things you can do as a pet owner.
This podcast is proudly sponsored by Hill's Prescription Diet. Does your pet experience food sensitivities and fat sensitivities? ZD Low Fat is specially formulated with hydrolyzed soy protein and low fat levels to help avoid adverse food reactions and promote healthy skin in dogs with food and fat sensitivities. The Active Biome Plus ingredient technology is clinically shown to rapidly activate the gut microbiome to support digestive health and well-being. Enjoy the benefits of healthy gut and healthy skin for dogs with food and fat sensitivities with Hill's Prescription Diet ZD Low Fat. Yes, that's all that benefit in one food. Visit your vet to learn more about how it can improve your pet's well-being.
Definitely one of my top 3 things for pet owners should do is get to know your pet. They are more than just a living soft toy or like a piece of furniture at home. Even the less interactive pets like your fish, you do know you if you pay a bit more attention, look at them, I think you'll be a bit more amazed at what you see. I think that was even probably the most apparent during the COVID period, where everyone suddenly all the animals have so many problems because everyone was stuck at home, and then I'm now staring at my pet 24/7. So we saw that in the UK as well. Sudden influx of people. He's just behaving different. I'm like, what do you mean? Today he ate a bit less of his food. And I'm like, But that is important. Of course, it's also important to. Sometimes we're not so concerned with a single change, but patterns rather than absolute values sometimes are a bit more helpful. Or maybe he just doesn't like the food you gave him today. If you're changing food every day, then maybe he just really doesn't like it. It's like, have you tried feeding him anything else? But, oh no, we didn't. Then I don't really know if he's off the food because he doesn't want to eat, or he's off the food because he's really sick. But there's always, you see things in big picture as well. Is he just being picky? Has he been picky before? It's like, oh yeah. Then okay, let's probably been picky. Have you tried something else? That kind of stuff. But I think never a bad thing to come in for a check. If in doubt, just go At most, you have a peace of mind to know, okay, everything is fine. And then if it is something a bit more sinister, then at least you jump on it sooner rather than later.
So, going back to your practice, right? Do you have any particular area of interest?
Wow. I think the people that know me will know I'm interested in everything. But if we're talking about very specifically the field of veterinary medicine that I was very interested in, or still am, would be pathology. It's not something you get to practice in the clinic very much. There's clinical and anatomical. Clinical pathology refers to all your blood tests, your blood work, your when we say we take a sample and we do a fine needle aspirate, that's cytology, that falls under clinical pathology. If we say we do a biopsy, that falls under anatomical pathology, so we do histology. I suppose my deep love is still with anatomical pathology, so I do enjoy doing postmortems, investigating diseases in that manner. But you definitely don't get to do that so much in the clinics. But the thought process is there. You still ask the same questions. How did this happen? And then we slowly figure out how. I think that really helped. And I suppose the knock-on effects of being interested in pathology kind of draw me a bit more to things like surgery and diagnostic imaging. And I suppose a little bit on internal medicine, although I can't say I'm particularly passionate about that, but things that help me, I suppose, put together the answers or the pieces, or how do I get the information I need to build the picture and in order to help the animal. So yeah, I suppose to long TLDR, right? So probably diagnostic imaging, X-rays, ultrasound, your surgery, a bit more soft tissue side than orthopedics, and then a little bit of internal medicine, sprinkle on top, yeah.
Okay, and just now you mentioned a bit already, but what are the 3 most important things that you would like pet parents to know?
Oh, that's tough. There's so many things. There's so many things, but I think first and foremost, get to know your pet. Whatever you are the pet parent of, be it bird, fish, turtle, dog, cat, white tree frog, whatever you have, make sure you know your pet, because I think that is probably the first and the most important way that you would know something is wrong. Because there are a lot of things that everything has their own personalities, they have their own quirks and behaviors that may be normal for them, but not normal if we look at it from a generic point of view. Yeah. I think second one would be find a vet you trust. If you keep vet hopping, it's also very hard to you need there are a certain amount of consistency so that the same pair of eyes looking at the same thing can probably pick up a pattern or a trend or a change in that sooner than you ask person A, then B, then C, then D. and then everyone will give you, if you're lucky, is a problem that is consistent enough that everyone says the same thing. But a lot of times we get issues that are a bit more subtle, not so easy to get everyone might have a slightly different opinion, and then all you do is confuse yourself and delay treatment for your pet lah. While it's perfectly fine to get a second opinion, I think if it helps you, it makes you feel a bit more confident, then sure. But I think it's just like finding a doctor lah. If you find a doctor you trust, then you are likely to continue, and they can give you better advice, more tailored to your needs. So same likewise lah. Find a doctor you trust for your pet. Someone that okay, is in line, hears you out. Also seems to like your pet enough lah. Yeah. And I think the third one is probably set aside, make a little piggy bank for your pet lah. I think a lot of times we forget that. I suppose we are very fortunate in the sense that we kind of have things like your MediSave and all that too, and a lot of subsidy for human health lah. That I think sometimes we forget that on the animal health side we don't tend to have as much. You don't typically. So I think one big difference between UK and Singapore is the kind of pet insurance and the coverage as well. In the UK, we hardly have, or we don't hear so many issues about like cost-related complaints. A lot of the owners have insurance, and some of them have better coverage for their pets than themselves, which is quite impressive. And some of them will be like, yeah, don't worry, my insurance will cover it. Just do whatever you need, kind of thing.
Oh wow.
Whereas in Singapore, I think it's like the pet insurance is still at its, I won't say infancy lah, maybe the toddler phase already. It's kind of growing and evolving. So coverage wise, I think they're still learning what is helpful, what is not, and not as comprehensive lah. But certainly having I know people who have a little piggy bank for their pets. Every maybe month they put in like $200-$300, depends on you lah, and then you just build a small little sum, and just save that for whatever you need lah. Because the last thing you want is to end up in a situation where your pet needs something urgently, and you can't, I suppose you can't pay for it lah, and I think that's also tough it's always tough on the clinics, because we're like, as much as we want to help, I also can't do things for free lah, because it does take time, it does take resource, as much as I think if every vet had it their way, yeah lah, we'll just do it lah, but we can't, and in a very realistic way lah, because we need to pay our nurses, we need to pay the other staff that support us as well, and everything does cost money lah, unfortunately. I think the argument we always have is like, if you go for a meal outside, you eat the meal already, then you tell a person, I can't pay. They're not going to pay, so poor thing. Off you go, then to be like, no, you find a way to pay, right? Of course, it's a bit different, but I think if you make the choice to be a pet owner, I think it's part of that responsibility to also make sure you have enough to give it what it needs, not just food, the daily necessities, but I think also any sort of medical needs,
Yeah, I think we've covered also this in other episodes as well. As a pet parent, when you get a pet, you also need to consider about the cost that comes with it as well, especially medical costs can go quite high, especially if your pet needs a surgery and all that. So these are things to consider also before getting a pet as well. Yeah, thank you so much, and we'll see you guys in the next episode.